Hello, my first years. So, you must be all overwhelmed with the feeling of choosing MD Pediatrics as a branch, all those emotions running down the lane of choosing the field. Choosing a field is nothing but, as it said, it's like marrying someone and you have choose it for a lifelong. So, there's no going back after all this. Let you know how it is going to be. First year will be all about those paperwork, those case sheets, doing all those examinations, securing those IV lines, and just running about here and there, the sampling collections, getting all those reports done, following the orders of your seniors. But in all those chaos, the crying of the kids, the crying of the parents, and you also crying, let's jot it down it for you so that you just don't feel that you have wasted your first year in just working it out and you have not gained the knowledge. You have not got the time to like if you would have started a bit early in studying and then you would have think, yeah, probably I would have done much better, not realizing it after the 3 years end. It's better you started now and started in a very systematic and a well approached way. And I hope that you find that this video very helpful for you, and considering me as your co-guider, I just hope that I make this very easy for you. So, what are the expectancies of the first year? The first year, as I have already said, you have to complete all those case sheets, the daily rounds, the discharge cards, the examinations, the history taking of the patients, whoever are getting newly admitted, the sampling, jotting down or what all the samples has to be set next day in early morning, mid, in the afternoon, what all the reports have to be get done. So in juggling with all this, it's better that you get sorted out. What I did in my first year was, a day prior I used to prepare myself for the next coming days. And this is the point where most of the PGs lag behind. What they do is like, yeah, chalo kal dekh lenge, let's figure it out next day. But no, guys, preparing makes your day a bit more easier, and you have time for your own self. You can do whatever work you want to study. Let you know how are the benefits and the perks. So a day prior, make all those discharge cards ready, which you are probably thinking will get discharged a day or the next 2 days. Just don't write all those follow-up medications and nothing, but just make sure that you have done with the course of patient, what is the treatment given in hospital, all those demographic details, the investigations what have been done till now. So mentally you're prepared in that. Many of the hospitals, you must be having interns helping you out in filling up all this discharge cards, and many don't have. So being prepared prior is much more easier. Being the case sheets, some of the hospitals have a well pre-filled case sheets. Just you have to write early in the morning, take those vitals, write it down on the sheets, and write down the treatment which has to be given on that day, and the changes and modification as per the round goes. Being it prior, the day prior, you just make sure that your all the investigations which the seniors have been told, and it has been come from the hierarchy, what has to be sent in the early morning, just draw all those samples and collect it out. Make sure you're collecting a bit extra, because children become more a bit of cringy, and like they don't allow, the parents don't allow, and the samples don't go on time. It all is a mishap. Better collect extra samples. Sometimes the lines also getting in this kids is very difficult. I do understand. Till 3 years, like it's a bit difficult part, getting all those sampling and without an intracath and all. So just hold on and get those extras. It's going to benefit you nothing else. And so make sure you know that which all the samples you have to collect early in the morning, which you can delay till afternoon. In the rounds itself, make a jotted down list of all the samples which you think that you have to collect it. The seniors, as discussed, what are the line of treatment. So make, I used to make a 100 pages book, and each page was dedicated for a patient. So in that I used to write, yeah, investigate and investigations and treatment. If there is any change in treatment, if there is change in any investigations or any adds on, any deletion of anything of it, maybe it a investigation, maybe it a treatment. This goes for your rounds part. Post rounds, just take out, I know the rounds get delayed up to 1 o'clock. Have a good amount of lunch after that, breathe for half an hour, 20 minutes, and start with your work. Just in 1 hour, make sure you're finishing all your word work, finishing all those samples that has to be sent till the evening rounds, the samples which have to get in the next morning. Make sure you have done all those works. And also the addition deletion of all the medications, so your medications have started itself that time in the afternoon or in the evening. For us, it used to be around, used to get over by around 12 o'clock or 12:30, because it used to start early. Basically our rounds used to start in morning 6 o'clock. We used to take all those vitals, making out all those sheets, and this used to take about 1.5 hour. Around 7:30 ish I used to finish everything. 7:30 to 8 o'clock, have a mild good breakfast. From 8 to 8:30 around, our APs or SRs, whoever is there on call, they used to start with them taking up all the rounds from PICU to NICU to ward. And after that, 9:30ish or 10ish, 10:30ish around, our professors used to start with their round. The unit head sometimes, or the HOD, who is ever is taking the round. By 12:30 it was all over. So in the span of 12:30 to 1, what I used to do before going lunch, I used to start up all the medications, whichever new medications has been added by the concerned professors or HOD, started before the lunch break. Delete all those ones which are not there, inform the sisters that these are being deleted, and like these are not to be given, and these are the new ones which has to be given. Start with the medications. Sampling also, after like post lunch, then I used to come collect those samples, send it out. So by 4, like 5 o'clock, 6 o'clock around, those samples used to be ready for the evening rounds of the SRs and AP. I guess I know this is pretty good, but post 3 o'clock, like most I know, most of the residents feel, it has been a very hectic day. Choo choo, chow chow. The senior is chillifying you. Everyone are behind the first years. Yeah, take a rest of half an hour, 40 minutes nap, and get down to the lane of what all patients you have, why did these investigations were done in the particular child, what is the case about, what are the diagnosis which you are coming about. Make sure that you try and read at least a few things, like the what the main points, what is the clinical features, the investigations, the treatment, why the professors have supported this treatment. And make sure that you're going on through the recent guidelines. In pediatrics, you have to follow the recent ICU protocols or the NICU protocol, where and where you have posted. And then what you have is like the IAP guidelines, the NNF guidelines. So IAP is an association of Indian Academy of Pediatrics, the Pediatric Association, which set out a guideline for all those diseases. And not all the diseases are covered, but a few of them which are very important and used in day-to-day practices, these guidelines have been covered. The NNF, that is National Neonatology Forum, it covers the guidelines for only the NICU. And make sure that you are up to date with all those guidelines. So the first year is all going to be hectic. I know you have to take out a time for yourself, but this afternoon to 6 o'clock, you have a good time before you start with your evening round. 6 o'clock is a good time, you start with your evening round. But these 2 hours, like 4 o'clock to 6 o'clock, make sure you keep this time for you, who, if you have finished all those works and everything, you're hectic done, you must know where to organize. If you have interns, you must know where to get in all those works done. And by 4 o'clock it to 6, it has to be your time to study your topic. Be Just make sure you're reading it out from your iPad or a book which you have kept in the wards, NICU or PICU. Just read out those topics. Hardly it will take an half an hour and 1 hour, but these will give you an extra edge for the next day rounds, and you're well prepared. Why the professor has changed this medication, what is not happening in this child, why these medications are not working, why so and so antibiotic is being changed. So you are not clueless. Just first year, as I know, they are just roaming behind what all the orders you're just following. You don't have to be the postman. I'm telling you, don't have to be the postman. 3 years down the line, you'll just remember what all work you have done in first year, how much knowledge you have gained. And procedural knowledge, you have to be pit and pat in all those procedures. IV line is a must. You must know how to do an IV line. All those difficult IV lines, all sorts of IV lines, you have to be very clear about. First year, since me being the first batch of the PG in my institute, all those procedures were done through us only. So like we were the ones, there were no seniors, and we had to get out from like the SRs or AP who used to observe us, and they used to tell us and teach us like how to go about this. Mainly for many of the few months, there were like the professors guiding us like how to get about the procedures in NICU. If you are there, you must know an umbilical line, you must know an umbilical venous line, arterial line, the surfactant procedures, intubation is the must. Only you must know that there is no exception of not knowing, in that you don't know how to intubate. It's very easy to intubate a neonate, that it's rather difficult intubating pediatric age group, like more than 10 years or 12 years down the line. So make sure that you know the intubations, the lines like the PICC lines, the central lines. I know most of the second years and third years do it, but make sure that you two have the hands on. Bone marrow is the must. Lumbar punctures are the must. You must know the details of the procedure, how to carry it out, when are those sampling has to be sent. Gastric aspirates and although it is a daily mal masala. Morning, it's just you have to take out the gastric samples, send it out for the CBNAT and AFB screenings, and these are just a small procedures like the Foley's and the RT, that is the everyday procedures that has to you have to know within the first 1 week itself of joining MD pediatrics uh, as a resident doctor first year. And yeah, I just hope I'm very clear about the procedures. The first year will be a rotation in the sense there will be particular months dedicated. You'll be posted under a unit and in a particular ward. The few months will be your 1 or 2 months will be NICU, 1 or 2 months will be your PICU posting. So there and there itself, make sure that you have cleared all your doubt. You by the entering the second year itself, you know, yeah, this is the protocol which is followed in a hospital. These are the antibiotics which are the first line. These are the step up antibiotics. These are the step up medications which has to be added in such and such scenario. You must be overall known to this, and in between you must also have the knowledge why it's been started. So considering that you are posted in NICU, AIMS protocol is a very good book. You can go through the guidelines, it's very easy. You also have the NNF protocols. You must know which are the first line antibiotics to be started and how to go about it in first year of NICU. Make sure apart from all those procedural works, you know why you're doing a follow-up for a BERA or a OAE or a ROP, when are those screening to be done. You must also be well versed with the guidelines that when to feed the neonate with a breast milk, with a non-nutritive sucking, with an RT, with the IV. These all good protocols have been given in AIMS, and you have to follow it out. Whenever you are starting all this protocol, make sure you read the front and back, like why are you starting it, up to what frequency you can give to a neonate, when you have to stop the feed to the neonate. These are all the emergencies which you know that neonates are just born and they don't tolerate more amount of feed. So you know, like what's the point where you have to stop giving the feed, what's the point where you have to restart the feed, and what's the point where you have to consider that it's a sepsis and you have to start adding antibiotics. I just hope that post 6 o'clock, your rounds, evening rounds, your informing is done. Have a good amount of dinner. Make sure you are having time for your own self, and make a jotted down list of all the books you're going to refer in those posting. Like I have already mentioned in my previous videos, if you want, you can go ahead. These videos are made what are books to be followed and what books are to be considered for a particular subspecialty if you are more curious about. For PICU, it is Suchitra Ranjit, it is best and best. IEP also has the ICU protocol book. For NICU, you have the Clohati or the AIMS protocol. These are the two books. The PGI guidelines for NICU protocol is also there. If you find somewhere those PDF, it's well good, but AIMS covers most of it, so there's no need about it. And make sure that you're reading all the ward topics of all the ward patients, like nephrotic or a rheumatic or fever of unknown origin, like all those cases of SLE, be it glomerulonephritis, through Nelson, and making out your own notes. Or if you want a very easy one, you are reading Mukesh. But make sure you are at least reading one topic a day, and not any other haphazard topic, at least the patients which you are seeing, because this gives you a mindset till the start of the second year that yeah, this is the way, and you are taking most of the burden of starting out the treatment, planning it out. You are not just asking and irritating your seniors, yeah ma'am, can I start this, yeah sir, can I do this, what has to be done, I don't know. You just have to sort it out over there and there itself. And make sure that this just gains a much more confidence that what medications you have been studying. This makes you more confident enough in your future practices post clearing out MD pediatrics. Your life just doesn't lie being a resident doctor, it is there much more beyond. And that confidence is what keeps you alive post residency. And yeah, I hope this video was not long enough, and I'll be also making a video of what is to be done in second year, how to approach exams in third year. For this, you have to comment down, subscribe to the channel, like it, share it with the friends which you feel that they need it. And yeah, this is Dr. Hemangi Reddy. I just hope I have done the best from my side to help you out. Yeah, thank you.